we will be inviting all of the candidates for office, both state and local, and they'll be doing short presentations. And then what we euphemistically call speed dating, where we sit and they move. So there'll be time to ask lots of questions as well. Well, now, I really want to say a few words. Our speaker today is Lidia Diebolt from the Centro Resource Center here in town. Immigration has been in the news a lot, and most of the things that we hear about immigration, at least from my perspective, has not been very positive. So I think we have lots of questions about, how is this impacting Lawrence? How many people are we talking about? What kinds of services do they get or need? And what can we all do to be helpful in this endeavor? Centro is kind of, excuse me, I've got allergies and they go right to my voice. Centro is the bridge kind of between Latino families, connecting them with language, culture, and community. One of the missions of this group is also to cultivate awareness and a sensitivity to the Latino culture. They provide a lot of services. Lidia herself is a licensed clinical social worker and a master's level social worker. She has also worked in private practice as well as her full-time job at Centro. So she does provide all kinds of therapy services, counseling, cognitive behavioral therapy, help with grief and bereavement, PTSD, and many other things. And she's also worked with both children and families, and adults, I should say. So it's with a great deal of pleasure that I turn the program over to you.
Hi.
Oh.
Well, thank you for inviting me to speak today. I'm Lidia Diebolt, and I'm from Centro Hispano. Actually, we're Centro Hispano. El Centro is in Kansas City. But we, as Marlene had shared with you, we work with the immigrant community here locally. And I thought that I would just open up the table to various questions. I have a list that people have.
Excuse me, I can't hear very well. Could you speak a little louder, please?
I will try. I have a very soft therapy voice, and it's hard for me to project that. I need to maybe put on my theater hat. Okay, there you go. I have a list of questions that you have that you sent to me, that you presented me with, that you would like me to address. I am also open to receiving any questions that you might have that aren't on this list, and so I thought I would just go down the list and sort of address what you had sent to me that you would like me to bring up in the presentation. And the first question that I see on this list is, have the number of immigrants coming to Douglas County increased or decreased in the last several months? And are they family groups or individuals? Okay, first of all, I cannot speak for all immigrants because I work specifically with immigrants that are from Latin American countries. The majority of the immigrants that we serve at Centro Hispano are from Mexico. We do serve some immigrant refugees from Guatemala and El Salvador, but we primarily serve families who are of Mexican origin. I would guesstimate that 70% of the families, and this is just a guesstimate, that we serve are indigenous Mexicans, meaning they come from an area of Mexico called Guerrero. This means warrior. I don't know if any of you remember from the news or read in the newspaper. It was like 2 years ago, there was a group of teachers that were executed and their bodies were burned in an area near Oaxaca. south of Mexico City, and that area is Guerrero, and that is the same area that the families we serve come from. Many of them, Spanish is their second language, and they speak an indigenous language called Tlapanec or Mixtec. We have more Tlapanec speakers than we have Mixtec speakers. Many of them are bilingual in Tlapanec and in Spanish. We do occasionally encounter an indigenous family that does not speak Spanish very well, has not learned to speak Spanish very well, and we have people that we work with in the community who are safe, who will come in and they will translate from Tlapanec to Spanish and from Spanish to Tlapanec. And so that's how we're able to serve them, as well as Mixtec speakers. We have a couple of families that are refugees from Guatemala, and they speak a language called Chu, and we don't have any luck with that. We just have to speak very slowly, use gestures, movements, sometimes we draw. They do have some command of Spanish, but it can be a little bit challenging or difficult to work with them. I have not seen an increase in the number of families accessing resources at the center, but nor have I seen a decrease. It seems to be pretty steady and pretty even. There was a period of time a couple of years ago where they tightened border security, and the border wasn't as porous for a while, and there weren't as many people coming in, but people figured out how to circumvent that, and that changed. We also have people who are deported and then return. That is also becoming increasingly difficult. We have a lot of families who are experiencing a loved one who was deported, who tried to return, and they are now in these private pay detention centers where they will keep them for 6 months and make quite a bit of money off of them on our tax dollars. And I expect to see an increase in these private pay detention centers and an increase in border security. And that's just from what I have read in the New York Times, heard on NPR. So this isn't any kind of special information that someone has given me. That's just me taking in the news. Typically people, in my experience, come in families. Sometimes they come individually. Typically it will be a mom and maybe a small child. Sometimes a couple will come together. But what I see when people are fleeing, many of the people that come, they're refugees. They're either economic refugees or they're fleeing gang violence. They're fleeing something far more horrible than what could happen to them being detained at the border. They're here for a reason. Currently, I'm working with a mom who has an infant. The infant is, he is 32 days old. He has his own deportation card. They came under very desperate circumstances. She has her own deportation card, and then the infant and the mom have to report to immigration, to an immigration officer. And so if they don't make it to their meetings, then they would be deported. They did not separate this mom and this child, and they did give them another 6 months before their next deportation hearing. So that's one family that we're working with that are they're recent newcomers. Another family, they're refugees from Guatemala. They were threatened by gang activity, threatened that they were going to be killed. And so the mother came with her 7-year-old daughter. They were caught at the border. They were not detained. Mom was given an ankle bracelet, and this was 6 months ago, so I think it was before they started separating children from their parents, and they were let go. For whatever reason, the child wasn't given a deportation card where like she has to go and see an officer, but the mom was. Very hard for her to find employment because she's got this tracking bracelet on her, and there aren't a lot of kitchens or hotels or places that want to hire someone that has a tracking device on their ankle. And that mom, we've been providing services for, and she has a really hard time too, because she speaks an indigenous language, and her Spanish is not she's not fluent. How many immigrants are living in our community? I can't answer that question either. We just see the people that we see who come in. There are many immigrants from many different countries. A lot of them do not register with the Census Bureau for obvious reasons, and we are not encouraging that this year. We encouraged it the last time there was a census, or this time around. We encouraged it the last time there was a census. The city was great. We met with them. We talked about counting and how that would lead to ESL services, all kinds of things, but this time around, that's not something that we feel comfortable or safe encouraging with our families. So I don't know how many immigrants are living in the community. We served 80 families last year.
If they do not have the census or citizenship question on the census form, will you encourage the people to work with the census?
I would need to sit down, and I would need to have some meetings, and I would need to talk with people before I would feel comfortable, given the current political climate, and anyone providing any information to the government at all, in all honesty. And I'm not trying to be provocative. I feel very protective of our community, so.
Understand.
Do immigrants in our community feel safe contacting the police or medical personnel if there's an emergency? In my experience, yes. We have a police force that has gone out of its way to say we are a friend to the immigrant community. We are not agents of deportation. We do not want you to be afraid to call us. People call the police freely without worry. Currently, the families that I work with, that tends to be the situation. If someone doesn't call the police, and they're a victim of a crime, it's more because they're worried about repercussions within their own community or from the perpetrator, him, her, themselves, versus the police or medical personnel. What services do we provide? We provide case management and mental health counseling. We are funded by a grant. We have the early childhood community, the ECBG Early Childhood Community Block Grant monies. Rich Minder from Success by Six writes an RFP every year. We're able to pull down funds from that, and that pays for my salary at 30 hours a week, a case manager's salary at 36 hours a week, and a third case manager who's like a therapeutic case manager who has an MSW and is bilingual at 30 hours a week. In addition, we've been able to piece together some funding through the Kansas Health Foundation off and on. I'm in the process of writing a grant right now for the Kansas Health Foundation. We would like to have a DV, a domestic violence advocate, to go to a bilingual person that we would share with the Willow, who would go to court hearings and take survivors through that process and provide them case management services in addition to just being there as an advocate and holding their hand through the court process. We would also like that person to go to Franklin County one day a week, because there are many needs there, but we're not funded to serve Franklin County. Now, if someone from Ottawa came to the center knocking on the door and said, I need help, I wouldn't say, go away, you live in Franklin County. We would assist her or him or them to the best of our ability. So what types of cases do we handle? Well, does that mean other counties or other countries? The question says, what types of cases does Centro Hispano handle? If only Hispanic, where do immigrants from other countries receive assistance? I don't know the answer to that question. There are 3 of us in a tiny little blue house with big caseloads and a lot going on. And so really, we just have to focus on the community that we're funded to serve. So I'm not sure what they would do in that case. Is housing and work easy to access in Lawrence for immigrants. No. No, not at all. There are a lot of challenges and barriers to not having a social security number. Some places will take something called an individual taxpayer identification number, which is called an I-10, and it has the same series of numbers that you would find in a social security number, and you can use it to pay your taxes. The IRS doesn't care if you're documented or not. They'll take your money, and they don't report that or share that information with the Department of Homeland Security yet. So, I mean, once again, I don't know where we're headed, but at this point in time, that isn't happening. So some places, all the utility companies are now using that as an identifier. This was not the case. Like 10 years ago when I started, it was a real struggle for people to have utilities in their name. But the utility companies have worked with the families, and now they will accept other identifiers such as the I-10 to set up utility service. They will accept a passport of from a country that is not from the U.S. They will accept something called a matrícula consular, which is an ID from the consulate of the person's country of origin as an identifier, and that has your address on it. So it can take the place of a driver's license, but you can't drive with it. In that it has, it's like an identifier where you would ask for, someone would ask for your driver's license, and undocumented immigrant can hand over a matrícula, and many places will accept that. And we strongly encourage immigrant families to go to the consulate and to get a matrícula and utilize that.
Where's the closest consulate for most of these people?
In Kansas City.
Okay, Kansas City, Kansas or Kansas?
Kansas City, Missouri, right off of Southwest Boulevard. You can, it's right down the hill and to the right from the Kauffman Center.
Okay.
And it's hard to find. You know, the first time I went there, I expected this big building, and it's just a tiny little. It's the size of the DECA building out off of 23rd Street, and the only real identifier is a Mexican flag hanging. And so it's teeny tiny, but they offer some services and programs.